everybody, happy Wednesday. I hope you're having a great day. Today I wanted to kind of compile some questions that I've been getting and hopefully address some of them because I feel like these are some common ones that I get. So we're going to try to kind of select about 5 each week and answer them. Because there's so much nuances to living with lupus, right? So the first question is, has anyone become a vegan since their diagnoses and noticed less flares? It can go both ways. I was a complete vegan when I was diagnosed, and I felt really, really bad. My body type probably needed some protein, so my Eastern medicine doctor told me to go back to eating not just any meat, but red meat. I'm not a big carnivore, so I had to sort of put some meat back into my diet. On the flip side, I have those of you who are all about plant-based diets, and that's what you believe. And for those of you who are for religious reasons that are taking a vegan diet, that's all fine. It's just making sure that you have good amount of or complete amount of amino acid profile. So knowing how to couple the proteins like rice and beans to make sure you're getting a complete protein is a good thing. But I have mixed things about this, right? So because some food as medicine for some people can be poison for those other people. So do what works for you, but I think the important thing is for you to realize exactly what you're sensitive to, and I can't say this enough. Go under files and go to Elimination Diet Guide. Always do the elimination diet to see what you're sensitive to. Once you're on it, it's almost like a protocol to heal your gut as well, to kind of take away any inflammatory foods. But in my opinion, no foods should be a toxin for anybody, but we lack enzymes and various bacteria in our gut to be able to break down. And so most of us walk around with metabolic dysfunction. So there's just so many layers that I can't say it's just about eating vegan or eating meat or anything in between. Does that make sense? Anyway, I'm going to end it there. If you have further questions, please leave me comments. I have another one. This is the interesting one. She says, I saw my rheumatologist for the first time last week. He said based off my ANA levels and the symptoms, he was positive I have lupus, but wanted to do more blood work. He prescribed me a medrol taper pack, and sent me on my way. I have 1 day left on this medication and feel the best I've felt for months. His assistant called today and said that the rest of my blood work shows that there is no lupus. Now he wants to put me on a prednisone taper pack to see how I do on that while he figures this out. She said how I do on the prednisone following the medrol will help him to make his decision. I'm so confused and don't understand what any of this means. Has this happened to anybody else? And I've been miserable for over a year now and felt that I was finally getting somewhere. Now I just feel defeated and I'm so tired of being tired and achy all the time. So let me just tell you, the medrol taper pack is the same thing as prednisone. And it's a very highly, highly powerful anti-inflammatory in our body because it shuts off our ability, adrenals, to produce cortisol in our body, right? So it's really a powerful anti-inflammatory, but it has secondary side effects, right? This is something that gets me really, really upset about it with this doctor because he just put her on it just to kind of get control over her symptoms, and he's now stating that that's what he's going to do and have her on for long term until he figures this out. We all know she doesn't have lupus, but if you've been having symptoms under the radar, but it's not picked up by the labs just yet, it doesn't mean you don't have a condition. This is the prime time for you to be getting busy reversing your illness because you're not diagnosed and all the antibodies aren't developed enough for it to be picked up on the blood lab results, right? And let me tell you, those lab results are not black and white science either. So it'll vary from labs to labs. And I've seen so many variabilities in research studies on what the optimal levels are, so much so that your levels can vary from blood draw to blood draw. So don't rely on that, but always be thinking about the health component and think about how you can build health. Going back to whether you have lupus or not, it's a safe bet right now you don't have lupus. But lupus is just think of lupus as just a name for something. Sjogren's for a name for something. Fibromyalgia, same thing. These are all autoimmune activities, and doctors have put these in a category just so we can diagnose and treat and get a code to bill the insurances. But in most cases, trust me when I tell you this, clinically, there's such a variability that you can't be foolproof into one or the other. So lupus can very well become something else, like you might have another fibromyalgic reaction. It can cause a different type of connective tissue disorder. It can become anything. You see what I mean? So it's a dysfunction of the immune system is the best way I want to describe it. And that's why I get so passionate about making sure that you guys understand it's all about gaining that balance back in your body, right? Once that's achieved, that you can do that without chemical interferences from the medications, that you can be positioned to help your body to promote its own wellness, because the medicine, everything that you need is within you. It's just when we start to hamper or we interrupt our internal balance by these doctors throwing medications at it, that we throw it further out of balance. So I would recommend, if you don't have any labs indicating you have lupus, you're just taking prednisone or medrol packs to kind of decrease those symptoms, I would beg you, don't do it. Just stop altogether and get on an anti-inflammatory diet or an elimination diet for a while and see how that does, okay? Trust me, you don't want to be doing that long term. It's going to cause more of a problem. So next question is, anyone had problems with their teeth because of lupus? Periodontitis, which is the inflammation of the gum, is a common disorder with lupus patients. We get sores due to, again, metabolic insufficiency. Why? Because we're micronutrient deficient. It's almost a sure bet that we have what's called a dysbiosis, which means we don't have a good ecological system inside. The bacteria that grows in our gut, it doesn't have a good balance. We want a good symbiotic balance of something that is good and bad, balanced so much so that it becomes a symbiotic relationship, one totally supporting the other. But if we don't have that, that gets into mucosal layer degradation. We invite the toxins within our system. It becomes a systemic inflammation. It then triggers our immune response so much so that it becomes chronic, and then we start to develop autoimmune antibodies. And then whatever that shows up, we classify into different segments of autoimmune conditions. So that's like the overall view. So when you talk about the gum, it's the systemic inflammation. So if you can really get some vitamin C in you, it would kind of calm that down. But also try coconut oil pulling. I know I kind of went segues. So the long answer to the question of has anyone had problems with teeth because of lupus, it's an absolute yes. The dentists know that there's going to be irritations at the gum because of the lupus, systemic inflammation. So they really take precautions when you do the history. So make sure your dentist knows that you have lupus when you do go see one. Okay? You are at risk. We're more susceptible to infections as well. Another question is, I hope everybody's day is going great so far. I have a couple of questions. One is, how would you know if the blemishes on my face are acne or lupus type rash? I've had sores on my face for a couple of months and they're just now starting to heal. In fact, yesterday was the first day I could wear any type of foundation on my face. Actually, it wasn't even foundation, it was BB cream. So the question to that is, you'll know when it's acne when you see the whiteheads budding, and it's an eruption of the skin, versus when it's a lupus-related rash, it's more of a flat redness and patches of redness. They're usually circular all over, or some patients just have like a map-like redness all over their body. Now, if you have discoid lupus, which means that you actually have an eruption of your skin mucosal layer, and then you start to have some sores develop on it, and that's a different thing. That'll look completely different. First of all, the surface area of the lesions will be a lot wider than, say, for acne. But acne, too, is another inflammatory response. But the acnes would be the whiteheads budding deep inside, and then it's just a localized redness, and it won't like come up all at once, like all together. It's, you know, it's sort of sporadic all over, and it's not as red as lupus rashes. I hope that that makes sense. Very good question, though. The second, old rheumatologist diagnosed me with lupus. I have a new rheumatologist who says she's not convinced that I have lupus or anything. So after being poked and stretched, I'm sore. I thought I at least knew what was wrong. I'm just frustrated. I know she's re-evaluating from her angle. It's just that I had to quit my job because of a number of flares, and I have had days when I can't get up. I'm in constant pain. I just like to feel better. I'm also nervous if she says I don't have lupus and takes me off Plaquenil. What if I do have lupus and it gets worse because I'm not on medicine? My blood work does not always show any irregularity, so I think that's the problem. I'm so frustrated. So oftentimes we get a lot of symptoms. Plaquenil is something that, you know, they consider it's a health insurance for lupus patients to kind of keep the flares down. But really, it's a very gentle, low grade, I call it the prophylactic, harmless little medication. Now, while some of you might not have the right detoxification pathways to handle Plaquenil, it's generally handled very well. Having said that, if you don't have lupus and if you're not seeing it in your blood work, in your serology, there's no need in taking Plaquenil. You probably might have some symptoms associated more with fibromyalgia. And Plaquenil is not a medication typically prescribed for fibromyalgia. So I wouldn't be so scared to get off of Plaquenil if you are not diagnosed with lupus. I would be really, really happy, and I would work on exercising, eating clean, and cleaning up my diet so that I can start to feel better, because that just means that it's reversible. So I hope this helps. I will try to get this on a regular basis. So if you have questions, tag me in this group and ask the question so I can kind of collectively do this all at once so that I can be effective with my time in addressing all of you who might have questions. I'll talk to you next time.